Well, good morning, everybody, and welcome. You've found the webinar, HR During a Pandemic. We'll get started here in just another 2 minutes or so. Welcome. A lot of people coming into the meeting room right now, and we are just a minute or two away. Okay, everyone, why don't we go ahead and get started on our webinar today. First and foremost, thank you so much for joining us. Just a crazy, hectic time out there. Thanks for taking some time to join us. My name is Matt, sans regret. I'm Vice President of Sales here at Payroll Systems. I really hope everybody is staying safe, healthy, obeying our new shelter in place and our new reality here. When we scheduled this webinar back in January, unemployment rates were at an all-time low, the economy was chugging along, and so we had a brilliant idea of sharing tips on how to recruit and how to make good hires, and just thought that was a great idea. Fast forward to March, and obviously things have changed just a little bit, and now we've pivoted, and we're doing a webinar on HR during a pandemic. So we realize how serious this current environment is, certainly realize how this is affecting everybody, both on a personal level as well as a professional level. And our goal here is to share some information to keep you updated on the latest events happening, whether that be here in our backyard or in Washington, and share some ideas, share some strategies, just anything we can do to help in this time of crisis. All attendees are muted for the webinar. We would love to encourage group discussion, group chat. Please familiarize yourself with the GoToMeeting software. There is a chat feature, a question feature. We'll be doing our best to address those during the webinar, and then we have allocated some time at the end of the webinar to stick around and have a question and answer session. Okay. We'll also be displaying full contact information. So you can reach back to our host today, or you can reach back to Payroll Systems for any questions. All right. Finally, a couple things. There are some handouts. And Julie, it looks like you're just not displaying the slides anymore.
Yeah, it was because I didn't close Outlook. It was my fault. I didn't want it to be shining while we're talking.
All good. All good. We do have a couple of handouts. The presentation is in the handout section of the webinar software, saved as a PDF. So please go download that now. We will also be recording the webinar and posting it to the Payroll Systems YouTube channel. That typically will go live within 24 hours. Okay, so let's go ahead and get started. So for those of you not familiar with Payroll Systems, we've been a leader in all things HR, payroll, time and attendance, consumer-directed healthcare plan administration, as well as HRIS software since 1989. We celebrated our 30th year last year. We work with clients throughout the Bay Area. We work with clients throughout California, anywhere from 1 to over 1,000 employees. And again, here to serve you in this time of challenge. I'm real pleased to introduce our guest speaker today. This is Julie Chendes. Julie's been with us on a couple other occasions for these webinars. She's an experienced HR professional here in the Bay Area. Julie founded her business, Next Level Strategies, 15 years ago. Next Level assists clients with all facets of employment, including recruiting and hiring, developing leadership, improving business performance, enhancing productivity and job satisfaction, guiding companies through good times and bad, events like terminations, separations, reductions in workforce, and also just helping negotiate what's a crazy maze of employment law compliance. So, Julie, just a big thank you. I know your life's just been absolutely bonkers the last couple of weeks, and I really appreciate you, first of all, pivoting on our topic a bit today and just sharing some of your valuable time with us. So thank you again, and looking forward to your presentation today.
Thank you, Matt.
Yeah, you got it. Why don't I go ahead and run through the agenda, and then we can get rolling.
Sure.
So first of all, we're going to, again, this seems to change by the hour, certainly by the day. And for our payroll systems clients, we're trying to get out at least a daily email or a blog post to our website or updates on social media to keep you informed of what's going on out there. Julie's going to recap some of the latest events as well. Want to go through the Family First Act, again, another item that seems to have changed a few times since it was originally released or originally approved last week. Talk about EDD programs and how employers might act on those. And then again, Julie wanted to share a few just ideas. What are the strategic options out there? How are we retaining employees right now? What are we doing if we need to term employees? And then, as I mentioned before, plenty of time for Q&A at the end. We'll be doing our best to address all questions. Find the chat feature, find the question feature in the webinar software, and we will get to those questions. So with that, Julie, I'm going to turn it over to you and let you go.
Thank you. All right. So I'm not an attorney and I don't play one on TV. And we've done our homework as much as humanly possible to kind of get ready for this presentation. I mean, I've read the actual text of these bills and a dozen legal briefs. So,
so dumb.
Oh, Matt, we've got some feedback in the back or something.
Okay, keep going. All attendees should be muted, so you should be fine.
Okay, thanks. Sorry, everybody. So let's talk about Family First, the Coronavirus Response Act. The first thing is it's for employers with less than 500 employees. So there was some confusion about this. Like even with some of our attorney partners, we're sending out information that wasn't correct about this. Everybody was saying effective April 1st, or April 2nd, sorry, and the DOL came in yesterday. Things are changing daily and said it's April 1st, not April 2nd effective date. So it adds 2 weeks of sick leave. It adds expanded medical leave to people who would normally not need to have FMLA compliance, right? So it's under 500 employees, effective April 1st, and then under the expanded family medical. Sorry, Matt, can you mute yourself, please? Sorry. Thanks. It's paid at 2/3 the employee's regular rate of pay. Okay, so first of all, sick leave. Let's do that first. Effective date April 2nd. Unless there's an extension, this expires on December 31st of this year. So one of the things I've noticed that our clients are doing is they're focusing on who do I have employed as of April 1st so I don't have to do this. Our understanding is anyone you hire this year gets to take advantage of this benefit. So it's not just the people that you have on your payroll as of April 1st, it's the people that you hire on April 15th and the people you bring back off of furlough on May 1st or whenever it is before December 31st. All right, so Just keep that in mind as you're doing your strategic planning for your rehires and your layoffs. Again, it's for people with less than 500 employees. Current employees, regardless of length of service, but like I said, your current employee may not be your current employee today, but maybe your current employee as of May 1st, if you're following my logic. So the leave entitlement is 2 weeks of paid leave, and it's going to be at the regular rate of pay. So you've got to calculate that. Part-time employees, you'll take an average, and there's a whole bunch of calculations to kind of figure that out, but you can look over a 2-week period. If they haven't been employed for 2 weeks, then you'll do a look back for 6 months. But if you need more information on how to do the look backs, the DOL has published something for you so that you know how to calculate the regular rate of pay for your part-timers. They'll just be prorated. Your out-of-pocket maximum per day for this is $511. So the reasons that they can take a leave, subject to a federal, state, or local quarantine or isolation. That's the sticking point. Some attorneys feel like it isn't clear as to whether that includes what we're doing right now, the shelter in place. My interpretation is that it does include, but yeah, we're waiting on some final word on that. I believe that we have been subject to an isolation order. Yeah. So they've been advised by healthcare provider to self-quarantine. They're experiencing symptoms of COVID, or they're waiting for a test, waiting for test results. They're caring for somebody who's sick, or they're caring for a child whose school is closed, or experiencing any other substantially similar condition specified by the Secretary of Health or Human Services. That's pretty broad. So a lot of people so far are hitting bullet 1 and bullet 5 because the schools are closed. And at least out here, we've been told we're closed until May 1st, earliest. Although Governor Newsom said it's unlikely the schools will resume before fall. So that could definitely put a crimp on a lot of people's, a lot of people's schedules. So then this is all for corona related stuff. A common cold wouldn't fall under these bullets unless they think somehow that the cold is related to COVID and they're going for testing. Let me see if I can mute something here. Keep getting feedback. Sorry, everybody. And it's making it hard for me to concentrate. Maybe I'll try to dial in. No, let's just keep doing this. Sorry. Existing leave policies. So paid leave under the new law is available to everybody in addition to what they have. Here's the catch. You cannot require employees to first use their normal accrued sick leave. You can't modify your paid sick leave policies currently in place to sort of accommodate. This is not accrued. It's dropped in over the top of everything else that you're offering. Paid sick leave under the new law doesn't extend past December 31st. It doesn't need to be paid out upon termination. There will be a notice to post. It's not up yet. Oh, wait, you know what? It may have come up just today. Hang on. I thought that let's circle back with you on that, but it may have come up today. But so far, I haven't had a chance to check email for a little bit, but it hasn't come up, but it'll be free and it'll be through the DOL. And then the FMLA expansion for all employers under 50 employees. So if you have fewer than 500 employees, this is for you. I know that sometimes boggles people's mind because they're like, well, we don't have to comply with FMLA, so we don't have to comply with this. You do. It's only for one facet of FMLA, and that is to stay home with kids whose daycare or school is closed because of the COVID emergency. Everybody is eligible if they've worked for you for at least 30 calendar days. That's also a change from regular FMLA. It's 12 weeks of time with the first 10 days unpaid, the final 10 weeks are paid at 2/3 time. Also a change from normal FMLA, which is unpaid. So you're capped at $200 a day. And if they're using, sick leave in conjunction with this, there's a whole different like sort of capping structure. But we have to allow for job reinstatement, same as regular FMLA. If you have less than 25 employees, you have more relaxed obligations under job reinstatement, but you're still being asked for the course of a year to try to hold people back in to their regular job, their original job. There are some published, there's going to be carve outs, there's going to be exemptions to companies with less for this. If they can show that either the sick leave or the FMLA is going to cause, basically their business to not become viable anymore. The IRS has popped in, I was going to paste this text in, but I don't think I did, and said that it's going to expedite reimbursements for this. So all of these two things have tax credits directly related to them that come right off your payroll and hit a couple of different areas of payroll. The IRS has said if you can't, if you don't have enough tax and payroll to cover whatever you've outlaid in the course of that pay period, they're going to expedite your reimbursement. Let me see if I can find the no, I can't find the text, but I'll find it for you if you need it. So it's just saying, yeah, it'll move to the top. They'll cut you a check as soon as possible. So, I mean, again, just one last thought. Like, there's an initial outlay for sure, which is painful. The intention of this is to actually have it be a benefit where people, employers get a quick reimbursement, so they're not actually out any money, which is sort of a misnomer, and employees get to take additional paid leave during this hard time. So we're relying on the IRS, which is dubious, I'm sure, but to get us our reimbursements quickly. Okay, the EDD has a whole bunch of programs right now that they've expanded for COVID reasons. Unemployment insurance, of course, right? And that is just swamped right now. I'm hearing that people are having, calling is never ever going to happen. If people phone in, they're never going to get through. If you go online to put in your claim, I would try really late at night or really early in the morning. And that's like when less traffic on the website because it's overwhelmed. We're finding this with our New York clients as well, that because New York and California are the most hard hit, they're just having a hard time even filing for claims. So late at night, early in the morning, and then there's a work share program. So with the new stimulus package that's supposed to pass tomorrow, it's passed the Senate, it should be passed the House today or tomorrow, and then the president said he's going to sign off. UI benefits will grow substantially. In fact, they'll grow so much that that's actually kind of a sticking point. I think a few of the senators abstained from voting because they weren't super happy with the writing of the UI piece. It gives an additional $600 to the weekly maximum, which makes perfect sense in California. It doesn't make perfect sense other parts of the country because if you take, it's across the board. So if you take our current amount right now is $450, which is pathetic in my humble opinion, because it hasn't been increased since 2001. Yes, 19 years. But if you add it to that, right, then somebody's actually making with their additional $600, $54,000 and what did I have up there? $54,600. $54,600. A lot of parts of America, people are making far more money on unemployment than they are working, and that was what the problem was with the change. But for us, it's going to be great. The workshare program. We've had a lot of questions about this. The whole EDD department or facet of the government is pretty flawed. There are 3 people working the desk at the WorkShare program. We talked to them a couple weeks before all this really blew up because we saw it coming. And the gal we spoke to said she's got 2 coworkers and that's it for the whole WorkShare program. So it may take a while to get approved for this. I do think it's a good benefit. There's a lot of administration involved. There's an 8-page application that you have to actually print out and fill out by hand and mail in, physically mail in. There's nothing you can do online. Each week they will send you a packet of forms for the employees that you sign up on WorkShare, and you will fill them out and physically mail them back in. And your employees are supposed to fill them out. So we're not sure, there's no way to do a wet signature right now because people aren't working together in the same building. So we're probably going to scan, have people e-sign, print them back out, and physically mail them in. It's just an antiquated disaster over there. But so just batten down the hatches for that. But here's how it works. See if you can follow my math. I'm going to use the current amount of $450 max to explain this to you. If people make more than, if they're on partial unemployment because they're working partially, right? And they make more than $600 in a week, they're not qualified for any benefit. Okay. So let me take a different example. I make $1,000 a week. My pay is cut 20%. So I've lost $200, but I'm making $800. So I'm over the $600 per week maximum. Okay. Following me? Under WorkShare, I am reimbursed up to $450 for the percentage that I am out of work. So under the WorkShare, 20% of $450 is $90. It's not a ton of money, $90 a week. But times 4 weeks, it's $360. And if somebody's on unemployment or partially reduced hours for more than that, that can add up, right? It makes it even better if you're thinking about somebody who maybe makes $2,000 a week. Their hours are reduced 50%. They've lost $1,000, right, a week. Through WorkShare, 50% of $450 is $225. Times 4 weeks, they're back up to $1,000. So it's reimbursing the percentage of time that somebody has been reduced, and it helps the people who are making more than $600 a week. So when you think about the administrative overhead, it really is a benefit. And I don't know how it's going to play with the new $600 weekly maximum addition. Hopefully that's included too, and then it's going to be a really nice benefit. So paid right now, until this kicks in, paid family leave and disability insurance pay more than unemployment and WorkShare. So if you've got somebody, and let me give you a tip that we realized, we've got a few heavily pregnant employees at different employers that we were going to lay off. What they ended up doing is going to their doctors, and this is definitely a person by person and doctor by doctor deal, but the doctors wrote them out early, a couple weeks early, because we don't want to be exposed to COVID either. We want to rest, shelter in place. So they got to start disability a bit earlier, and then because if they're not employed at the time of disability, there's a problem with getting on disability. So it's going to really be a challenge. So if you have people like that are going to be on disability in the next couple of weeks, if they can get written out early before you lay them off and then get on disability, then that would be better. I'm going to pop to the next slide. So some other cost saving options we've talked to clients about. First things first, right? Let your contract people and your temps go. I should move this one up to number 2. The other thing we've been asking for is volunteers. That's number 6. Who wants to go? There are people that are just living in abject terror about COVID-19. They're terrorized by the idea of catching it, transmitting it, dying from it. And a lot of them don't want to be at work. We've got a lot of essential businesses as clients, and we're getting calls every day about, hey, I've got these employees who don't want to be at work. What do I do? Well, if you're already experiencing a slowdown, maybe those are the people that you release and lay off. So there's that, right? So we're reducing hours. in a lot of cases. And I put in parentheses, watch out for the minimum salary basis. So if you've got people that are exempt and on salary and you reduce their hours, they still have to be above the minimum salary basis, which for small employers is, I'm going to go by my memory, I want to say 49,920. And if it's a larger employer with 25 or more employees, 54,000. Hang on, I'll do the math for you right now, and so you'll know. $54,080. So they can't drop below that. What we're doing in a lot of cases is converting people to non-exempt, which means issuing them a wage theft act notice, form 2810.5. You can find it free online, 2810.5. So they're getting issued a form that says they are non-exempt and they are taking their meals and being paid for overtime and being truly converted to non-exempt employees in all ways. If you can keep their salaries over $54,080 if you're 25 or more employees, or $49,920 if you're under, then you're fine to keep them as exempt. But just keep that in mind as you're sort of going through. A lot of clients are doing, pay cuts, reducing benefits and perks. I'll talk for a second about benefits in just a minute. Offering vacation time use to pay down, that liability. And then let me just talk about furloughs for a second before I circle back to benefits. We're getting a lot of questions about what's the difference between a furlough and being laid off. I mean, our attorney says nothing, right? They're materially the same thing. If people aren't working within a pay period, they're laid off, and you need to pay that final check and get that stuff going for them. Furlough is a nicer word though, because it implies that it's not performance related and we want you back. And as soon as we can have you back, we'll call you back. So there's that advantage to it, but just know between you and I and the wall that there's materially not a lot of difference between a furlough and a layoff. I want to talk about benefits for just a quick second. We'll be releasing a newsletter today with a bunch of information from Anthem, Blue Cross, Kaiser, that they are going to look the other way. It's in writing that they are going to look the other way until May 31st on reduced hours. Okay, because a lot of you are really freaking out about how to keep people on benefits and things like that, which I totally respect and appreciate. And a lot of the decisions that our clients are making have to do with keeping people on benefits. They're doing a lot that's really sacrificing their cash flow to keep people benefit eligible. One other kind of fun thing is that a lot of the major carriers are allowing reductions in hours, but that's contractual. So we did that for a few clients where we reduced the hour eligibility from 30 to 20. We're stuck with that until open enrollment, okay? So just to be clear, right? But you can reduce hours for eligibility as low as 20 hours, and the carriers were instantly responsive on it. We got our contract back right away. We were approved right away. And then that way we didn't have to sweat it out if, we've got people working between 20 and 25 hours a week regularly for the next period of time. But again, at least some of the big carriers, Anthem, Blue, and Kaiser are saying, we're going to look the other way till May 31st. As long as the employer pays the bill, all is well. So hopefully that takes a load off of a few of your minds out there. All right. Okay, what you must give to laid off employees. These are live links. So when you're able to access the slide deck, click. All right. Direct employees to file for unemployment online. I said that already, but here it is in writing. They won't get through on the phone. The application to file online is a live link on the slide, on this slide. So at the top of the page on the left side, there's a link to the Spanish application. We've had a few questions about people's citizenship and unemployment. They do need to be citizens. Unfortunately, the EDD is checking for things like that. And so that's going to be a challenge for some of our employees. They've been paying into the tax system, but they're not going to be able to access unemployment according to our resources unless they're here legally. On the other hand, if they go to back to benefits for 1 second, if they apply for the Affordable Care Act, the Affordable Care Act is not checking. So that's always a possibility as far as health insurance goes. I want to give you one more note about the Affordable Care Act, something that I learned last week that, again, we're going to blast out today to clients to make sure everybody knows this. I didn't know it. If you go from the employer's health insurance to COBRA, you've missed your opportunity to take advantage of the Affordable Care Act, which people are going to get, qualify, most likely qualify for a subsidy at this point because they are not working. And so if they're not working and qualify for a subsidy, the ACA is going to be a better deal. We call it Covered California here in California. But the thing is that triggering event is nullified if they go to COBRA. So you can go from employer health care to ACA or employer health care to COBRA, but you can't go from employer health care to COBRA to ACA unless you wait for the open enrollment period, which isn't until October. Just a little tip. Okay, so the other thing that you have to give out is the pamphlet from the EDD. It's called For Your Benefit, California's Programs for the Unemployed. It's the same pamphlet you give out to people on disability and on paid family leave. It's free of charge. You can get it in a variety of languages from the EDD, and I've got a live link for you there. Also from the EDD, a change in relationship form. And if you have 20 or more employees, you've got your HIP notice. Number 4 is your check. There's a bunch of details you have to include in a final check, which is, accrued, unused, vacation time, and PTO, all the dates included, regular and overtime, any sick leave or vacation that was used during the pay period, and all the tax information. One of the things that we've come across a few times with clients is they're trying to keep people on payroll either to extend them to the April 1st deadline of the new sick leave so that they can take advantage of sick leave and jump on that, or they're trying to extend them as employees to keep benefits eligibility. So we've already talked about that, right? That should be a managed issue. But I think it's wrong thinking because if they can be, like in one case yesterday, we were talking to a client that could have laid off its staff on March 17th, but they're letting people use sick and vacation to try to continue them, but that's preventing these folks from filing for unemployment. So the sooner they're on unemployment, the better. If you want to pay out sick, if you want to pay out vacation, great. You're going to have to pay out vacation anyway, or PTO, but then that way they're already collecting unemployment and they've already got a claim filed. So that's my thinking on that. And that's it. So we've got tons of time for questions, and I'm sure you've got lots of them. And in the meantime, too, I'm going to try to find that little thing from the IRS about what they're saying about the reimbursements for the.
Maybe get the question slide on there, Julie.
Oh, sure.
It doesn't. There you go. Hey, so first and foremost, guys, for everybody who's stuck through it, thank you. I realized that we had some major audio challenges there. I don't think there was any setup issues or people talking in the background here. I think what we were realizing is that basically the GoToMeeting and the online meeting software is just overloaded as well. I think it's just a bandwidth issue of the amount of folks on the call today and the amount of traffic that GoToMeeting's getting these days. So apologize for that. I'm not sure how the recording's going to come out. I hope it comes out better. And we will be distributing that when that comes out. So again, I don't think it was a configuration issue on anybody's end or people talking in the background. I'm pretty confident this was just a bandwidth issue with the traffic going on these days. So I'm going to get to a few questions here. We have some time, and so Julie, I'm going to start firing away here in a minute. Let me get organized on a few. Probably about at least 20-25 questions did come in, and
yeah.
I do want to get to some of them.
Okay, 1 sec. So I'm going to read this. This is off the IRS's website. Reimbursement will be quick and easy to obtain. An immediate dollar-for-dollar tax offset against payroll taxes will be provided where a refund is owed, the IRS will send a refund as quickly as possible. So, I mean, it's all sort of vague, but at least they're saying in writing that they're gonna do their best. Go ahead, Nat. Sorry.
Go ahead.
No problem at all. Let's get to a few questions. I'm just going to read them and we'll try to interpret. So basically, I think a general topic is the shelter-in-place ordinance or act a qualifying event? Does that literally mean that anybody with a shelter-in-place order is eligible for this benefit?
I'm sorry, Matt, I missed the beginning of that because of the feedback. Sick
just
time?
saying, does the shelter-in-place apply to the new Family Act legislation?
So there's what I'm reading from some of the law firms is that there's a little bit of a language challenge with the word isolation and shelter in place. So shelter in place sort of is isolating, but not quite isolating. It seems like the majority of the law firms whose briefs I've written think that it counts. We're waiting for more guidance from the DOL on whether shelter in place and isolating due to government order are the same thing. But I would say 9 out of 10 things I've read are that they are the same thing. We should know for sure this week.
Perfect. Okay. Next, so anyone we let go that we rehire will qualify. Again, some of these are not mostly, but basically folks that are let go and they rehire, will they qualify? This was a question early on in the presentation.
Yes. Yeah, I'm sure because we were talking about those slides early in the presentation. So it's supposedly, yes, if you're an employee between April 1st and December 31st,
Bae,
we're
not sharing the hammock.
Hang in there. Keep going. I don't think that's you. That's not me.
I am in dead silence right now, and I don't know who is cutting into our line, but it reminds me of the old party line days. Anyway.
Exactly. Again, I think it's just bandwidth issues with the GoToMeeting. Sorry. Yeah.
Yep. No problem. Next question.
Yeah. So if you hire a previous employee back on July 1st, do you have to go back to April 1st when that person was laid off or March 16th to pay the sick leave? And we had a few other questions just so maybe you can kind of summarize dates as far as you know it as of right now.
Yeah. So there's no retroactivity that's been made clear. No retroactivity on the new FFCRA stuff, but they get their whatever their higher pay. Let's think of a couple of scenarios. You lay them off on March 15th. Okay. Bill kicks in on April 1st. People that you have employed on April 1st immediately get their extra 10 days and their access to expanded family medical leave. But people that you laid off on March 15th don't get it. If you hire them back on May 15th, they're just as eligible as everybody else. We'll dump another 10 days into their bank on top of what you're already offering. And they have access to FFCRA. I mean, the one thing that is a little bit scary about this that we want to remind you of, and we were talking to clients about just yesterday, is that the expectation from some of the epidemiologists is that all of us are going to get this over the course of the next 2 years. The majority of people are going to get it. So being able to use the sick time to take care of sick people, to be sick, it's something that could come really in handy toward the end of the year as we run into, we're not even really in cold and flu season right now, right? Spring. But starting in, November, December, January, you could have a lot of sick employees out and we may have to isolate again. We don't know. And so being able to use this toward the end of the year is also a nice benefit for people.
Couple having to do with couple questions having to do with reimbursement. So I guess the gist of it is, how does an employer, what's the process to file for reimbursement from an employer point of view?
Yeah, they haven't come out with that yet. There's going to be, and Matt, I think you said payroll systems is going to inform people as soon as we all know what the information is on how to get reimbursed.
Right.
We'll definitely let people know.
Correct. And we're kind of waiting to finalize guidance on the tax credits and how that's going to work. So April 1st is a big deadline for a lot of things, and we should have at least a couple of new updates out before then for anybody who's a current payroll systems client. Again, let's circle back on this one just in case the audio wasn't great for everybody. So this just talks about interpreting the shelter-in-place ordinance. And does that mean that we automatically qualify for use of the emergency sick leave of 80 hours? So any feedback on this? My employer thinks the shelter in place automatically qualifies all to use the emergency sick leave.
Well, okay, so what I was saying earlier is that the majority of attorney briefs that I've read on this use shelter in place and isolation synonymously and seem to take the tact that, yes, it would be available to people who are sheltering in place as of April 1st. However, several legal briefs have also said that the word isolation and the term shelter in place are not synonymous, that one is more extreme than another, and that they might not be the same. And we're waiting for guidance from the DOL that we'll hopefully will get in the next week. If they're not employed though, so I guess what I'm wondering is if they're working, because I keep thinking about like the nature of the question, if people are working from home and they're working and they're doing their thing, right, then they wouldn't need to use sick leave. If they're not able to do their job from home, they're a restaurant worker, they're a landscaper, they're a esthetician, right? Then it would apply. But if there's work to do, people are still expected to do it. So hopefully that answered like the question underneath the question and the question itself, which unfortunately the short answer is we don't know yet. But
yeah,
probably.
Still a little bit of a gray area. So keep informed or keep posted for information coming from all angles.
Yes, it's probably.
Here's one talking about cap. So does the paid leave cap of $10,000 apply to both sets of leave combined? And are there any resources on calculating paid leave caps?
Yeah, so there's definitely a great resource. As of yesterday, the DOL came out with, we can get these links if you want to. The DOL came out with a whole sort of question and answer FAQ type thing, and it's a page called dol.gov agencies and pandemic. But if you just search dol.gov and then FFCRA, you'll find it, and it's got all the breakdowns on it of how to calculate, like for part-time people, how to calculate the rate of pay, and the qualifying reasons, and then the pay calculation and the tax credits, right? I mean, it doesn't give you details, but it just refers to them. I'm just glancing at it right now for you. But yeah, it's on their page. It talks about the cap.
Okay. And maybe what we can do is I'll organize some of the links, and we can do a follow-up to the attendees with several of the links we've discussed. So we'll talk about that. Couple more, if we have time, talking about applying for the exemptions. I'm assuming this would be the less than 50 employees. So any instructions on applying for exemptions for smaller companies?
So I've been waiting with bated breath to find out more information about the exemptions because a lot of our clients are under 50. There isn't anything yet. They're expecting it the first week of April. There's going to be a form to fill out. but you're going to have to document what kind of a hardship this is going to cause for you and some other things. So they're sort of hinting at like what's going to be on the form, but there is no form yet. There won't be a form for probably another week. But it would have to actually compromise fronting the money would have to compromise the viability of your business. So think about that, which for some people, 100% it will. Like there's just no cash flow. Like our restaurant clients, you know, they've got about 16 days of cash. So fronting everybody $50,000 in sick time is not going to work. But they're already closed down in most cases, so there's not employees to give this to, but there will be when everybody starts back up again, and then what, right? So think about the viability aspect and keep an eye out for the form. We will absolutely release that thing the second it's off the presses.
Good deal. Unemployment question. When I'm filling out a notice of unemployment claims, it asks me if my employee reasonably expects to return to work for me, and it asks for a specific date. How do I responsibly and realistically estimate when we will be able to reopen without affecting my employees' UI claims?
Yeah, there's been a few things published by the EDD that say that they're going to, both on the employer side and the employee side, that they're relaxing some of their questions. On the employee side, typically you would have to prove, not just say, but prove that you're actively looking for work. For the next couple months, people don't have to be actively looking for work on the employee side. On the employer side, I mean, you know, you could write something truthful like as soon as the, you know, shelter in place order is lifted, as soon as, you know, whatever. I mean, all you can do is answer to the best of your ability, and know that the EDD has said that they will be more relaxed about the way we're filling out our forms, just like the insurance carriers will be more relaxed about, you know, looking the other way for lower hours and eligibility.
Here's another one. Does an employer who cuts pay have to issue a DE 2063?
You know, that came up just the other day. It's funny because I'm usually kind of an egghead about this, but the client asked about it and we didn't even know that form existed. No attorneys ever talked to us about it. We've never read it in a legal brief, but yet it's there. And so we're going to ask one of our attorneys about it. And I haven't gotten a chance to do that yet, but it's just for all of you who don't know, it's a form that says we're reducing pay. We've never done one. I mean, in 20 something years of doing HR, we've never filled that out. We fill out a status change form, and certainly if we're going from exempt to non-exempt, we're doing the Wage Theft Act form 2810.5, because we're required by law to do that. But if you sort of look everywhere online, there's nothing that says you're required to fill that form out. The chamber, a bunch of legal websites and stuff like that, but I wouldn't want to tell you no, because I don't know it for a fact.
Okay, specific question here. As a dental practice that's closed and unable to see patients due to the quarantine, does this apply to us? I assume they are talking about the Family Safety Act.
Well, it'll apply to you when you reopen and you have employees again. So again, FFCRA is effective from April 1st to December 31st of this year. So anything you do this year, it's going to apply. And then unless there's an extension, the whole thing goes away on December 31st.
Okay. A couple of comments have come in on the topic of work share as well.
Yes.
With work share, and so maybe you have any general comments there. This specific one with work share, would this apply to exempt employees that have a salary reduction?
Yes.
I think that was it. Okay.
Yes. That was the example I was kind of trying to give, is that it applies to everybody. And in fact, it's more favorable to higher earners than it is to lower earners in some ways, right? Because lower earners, if they make less than $600 a week on partial, partial work and partial unemployment, they can still collect normal, regular UI. For anyone who makes more than $600 in a week, even working partially, there's no UI benefit without work-share. And work-share will give them 50% or whatever, the percentage of what they're missing out on, up to $450. Again, I'm hoping that turns into $1,050 with the new bump from the Stimulus Act, but we can't say yet. But yeah, it actually, I would say, favors higher earners.
Okay. And a couple of questions came in towards the end on regarding citizenship. And it's basically, does the citizenship, documentation, immigration status matter when regards to applying for unemployment? What about permanent residents? Would they still qualify? And basically, do you need to be a citizen to apply for unemployment? I think is the gist of these 2 or 3 questions.
Yes, you do. Permanent resident is a citizen, and they should be fine. Anyone who's here legally should be fine. But the EDD has said, it's on the websites, that if you're not here, with legal papers to work, then you can't apply. But you can for the ACA, for the Affordable Care Act, for Covered California.
All right. Good deal. How are you doing, Julie? You want to take a breath? We have several more questions.
Yeah,
and I'm happy to stay at least till the bottom of the hour here.
Yeah.
The audio does seem to have gotten a little better.
Yeah.
Good deal.
Bring it on.
You got it. As an employer, can we require employees to use their accrued vacation time during business closure?
No, unless you give them 90 days warning. This has come up a few times. It's come up on a listserv that I'm on for nonprofits and things like that. And you cannot, because vacation time is considered cash in California. It's already money earned by the employee. It's not yours to tell them what to do with, just like you can't tell them what to do with their retirement savings or any other savings or their mortgage. So unless you're going to give them 90 days warning, right? We can't tell them to use their sick time or their vacation time, sorry. If you want to allow them to use sick time during this time, that would be fine, but not the vacation.
All right. Is there any limit on how many employees can use the Family First Act at the same time?
No, not yet. And man, I sure see where you're going on that. And I hope that there's some regulation that comes out, but I don't think so, because the IRS is promising this quick refund. So I have a feeling that there's not going to be any training wheels on that. It's going to be an open invitation to take sick time and FFCRA, expanded FMLA. That's what
Fantastic. All right. General topic. Can you talk about reimbursement path for FFCRA?
Yeah, that's what we were talking about. Matt and I were a moment ago about the tax credits, that we don't have a path yet. There's not any guidance yet, except for the IRS putting in writing that it can come out all the payroll taxes. It'll apply to all, most of your payroll tax. And if you are still on the wrong side of it, that they will speed a refund to you. That's all we know so far.
Yep. All right. So stay tuned. Next question. I heard that an employee can file for unemployment for loss of hours without being laid off. Is this true, and how? We are an essential business and need to keep our techs available, but we're struggling to keep them working.
I think maybe the question.
This is employees filing for loss of hours, not necessarily terminated, but just filing for unemployment due to loss of hours. Yeah.
So what I was saying earlier, like about work share, is they absolutely can, but if they make more than $600 in a week, they will not qualify unless you've applied for the work share program. They won't get any benefit. So, so you'll want to do that. as soon as possible so that, your techs can actually take advantage of something under the UI program.
Yeah, so a similar follow-up to that is, again, this is a small medical office. If an employee typically works 40 hours a week, but only worked 4 hours this week due to seeing emergencies only, how does that affect a UI claim?
Yeah, so each week when they get their form from UI, they say if they earned any money, sorry, they say if they earned any money that week. So whatever was earned that week will all be offset by what they earned from UI. So
Yes.
4 hours, it's not going to equal $600 probably, unless they're really highly paid. I mean, maybe they are, right? If they're the actual dentist, maybe they're making $200 an hour or something like that, and then they wouldn't qualify for UI. But if they're making under $600, then they will qualify. And then certainly under work share, they'll qualify for something.
All right, keep coming in. We'll go for a few more. I think in general, we're seeing just a few broad topics emerge and then specific questions within there. Does an employee have to actually take time off to request the sick leave pay once they are back to work? I don't know if that makes sense, but.
My understanding is unless they can't double dip. So if they're there at work making money, then they're A, not isolating, they're B, not ill themselves, or getting tested, or waiting for results for a test, or taking care of a sick other, or taking care of a school-age kid who has nowhere else, no daycare or school to go to. So they would not qualify.
All right. And again, some more questions just on specific dates, because obviously this has been affecting people for the last 2-3 weeks, and everything's going into place on April 1st. So maybe one more follow-up. So this question is, are any new leaves retroactive? And again, my understanding is just nothing's retroactive, but it's for the time worked prior to 4/1. If we have a number of employees who've had to be out due to illness or school closures prior to 4/1, just one more time on that, and then I'll stop with the date questions.
Yeah, no retroactivity. But if you hire them back at any point before December 31st, they will still get to take advantage of the benefit.
All right, back to the unemployment. Is the $600 figure net or gross pay?
Well, on unemployment's not taxed unless you specifically ask for it to be. So that's what you're going to walk with. Like for the 450 is what you're going to walk with. But then obviously there's a piper to be paid on April 15th when you do your taxes if you weren't setting aside some part for taxes or whatnot. But that's the least of people's worries right now. They just need to get money coming in so they can pay rent and buy groceries, if they can find groceries. So
yeah, exactly. All right, let's see what else we got here. Maybe one or two more. The shelter in place is the first 2 weeks in April. Do we have to pay our employees the new sick pay? So this is the question. We're waiting for guidance on this one, everyone. Basically, the way shelter in place, or the way the laws currently states, it mentions the term isolation. Whether or not isolation is included in the shelter in place is still a little bit of a gray area. Julie's mentioned that she's talked to certain attorneys who think it is and others that don't think it is. So I think we just need to see if we can get some clarity on that in the next literally couple of days. So stay tuned. All right, let's see. Again, a lot of just rehashing. I'm just reading through a lot of the unanswered questions again. So we do have contact information on the line, everyone. I'm going to maybe take one more here. I went ahead and paid some of the sick time. That is now mandated on this last paycheck in March for my 4 employees. It was in anticipation of the law. Can I deduct from the 80 hours as of April 1st? I'm down to almost no money in my checking account.
Oh boy. I don't know that's going to work. I mean, the tax, I couldn't advise that on that. The law isn't effective until April 1st. So anything you did before April 1st, I don't know if you're going to be able to get reimbursed for. I hope so, but I feel skeptical.
All right. Okay. Last one, and then we'll wrap this up. I think, how do I prove, or how do you prove that you're actually taking care of another sick person, of a relative, let's say? What's the paperwork to actually use to prove that claim?
Yeah, that's a great
question. Is there
question.
any?
Nothing's come out yet. There's no paperwork at all on any facet of this thing. Yeah.
All right. Well, I'm gonna conclude things, Julie. Basically, I want to one more time thank everybody for joining us. We had a very large turnout today. I want to apologize for the audio troubles. Again, I've gotten several comments in the last 15 minutes that the audio troubles got much better. Nothing changed on my end. Nothing changed on Julie's end. I think it was just a bandwidth issue with the meeting software. So apologize for that. I'm really hoping the recording comes out okay. I'm sure it will. Still have some of the challenges with it. Also, if you haven't done so, grab the handout. That's the actual slides Julie was presenting to from the handout section of the software. We'll keep the screen live for another minute or two, and then we will conclude. So thanks again, everyone, and best of luck the rest of the week. And thank you, Julie. Really appreciate you pivoting on such short notice and being able to spend some time with the group today.
Thanks for having me, Matt. Thanks everybody for paying attention and asking great questions and taking an hour out of your super, I'm sure, crazy busy day.